Hi everyone and welcome. Good afternoon to you all. So I think we'll get started as more people join the webinar. So first of all, I'll just introduce myself. So I'm Rana Nassar, I'm the regional representative for MENA at the CALP Network, and I will be moderating the panel today. So great to see so many of you here already. So just to welcome everyone and quickly run through the objectives of today's webinar. So this is, obviously, as you all know, the virtual launch of World Vision's Middle East and Eastern Europe region report that is covering the transformative pathways to resilience and well-being in cash and voucher programming. So throughout the day, we have a great group of panelists with us who will each touch on different topics and through that disseminate some of the key findings and recommendations from the report. And hopefully that will be useful to all of you here to maybe integrate into your own programming or funding mechanisms. They will also be delving into the linkages between cash assistance and some areas including mental health, community cohesion, livelihood resilience, gender equality, and social inclusion. And also stressing the need for cash assistance to be streamlined through the various humanitarian sectors. So it's really great to see a report looking at these areas rather than the typical, or let's say the usual way we look at it as fulfilling basic needs. So really exciting to be looking at this today. And then another thing we'll be doing is highlighting the importance of coordination and knowledge exchange between different actors, which include UN agencies, INGOs, NGOs, and local partners within the CVA sector. So just to point out that there will be a Q&A session taking place at the end of the webinar. So please, as the panelists are speaking, feel free to drop your questions in the Q&A chat box, which we will address later. It would be really helpful if you just mention who the question is directed towards, so it will be easier to direct them at the end to the right panelist. So with that, I will introduce our first speaker who will be giving the opening remarks today. So that's Isidro Navarro, who's the Senior Technical Advisor for Cash Assistance at World Vision International. So Isidro, over to you.
Thank you, Rana. And it's very honored to be doing the opening remarks for this webinar. Thank you to CALP Network in the MENA region. And also thank you to all the colleagues that found the time to be participating today in this webinar. So World Vision, since the Grand Bargain agreements, have very strongly been trying to develop our capacities, our systems to be able to increase the use of cash transfers, cash and vouchers, in our humanitarian and development programs. This has been a long path. And so far we have increased considerably the volume of cash transfer programs we have implemented. We also see cash as an enabler for us to be optimizing the impact of our work, not only for people to receive money or vouchers to meet their basic needs, but also to, at the same time that they receive this assistance, they can also improve their financial literacy, their digital literacy, if they receive the money with an e-wallet or through the mobile phone. Also, the cash and vouchers, they allow us to link to government social protection systems and to do things that with traditional in-kind aid we couldn't do in the past. Okay. So, cash give us the opportunity to optimize the impact of our work, and is something that we try to continue improve and continue learning. Another aspect is that so far in our monitoring system we were looking to how people could meet their needs However, we didn't really know much about how people feel, and what is the impact of the assistance, of the cash we distribute, what is the impact in the community, I mean, how is cash and voucher, how are they contributing to the levels of stress in the household? How is affecting the community? Is it creating more problems, or is actually making people live better lives thanks to the cash or the vouchers provided? And so in this area we knew very little, and so that's how the idea of conducting this research started. And I think for the Middle East and Eastern Europe region in World Vision, it is the first of its kind. And we hope this can contribute to improve our learning of the impact of the cash and voucher assistance we provide, as well as to also use this learning to improve the design and implementation of our programs, to have a more people-centered assistance, that we provide to the people, in a region so affected by conflict, by disasters, always a lot of displacement. So it is very important that we consider what is the impact of the assistance we provide on the people and the communities. Okay. Also, I mean, World Vision, we don't do this work for ourselves only. I think it is important that with collaboration with CALP, we share the learnings, and the lessons learned with other colleagues in the humanitarian sector, so that we don't have to reinvent the wheel every time, and so we can all use this learning for our own programs, and we can improve as a sector. Okay, so I hope you find this webinar interesting. I hope you will be asking a lot of questions, and I mean, do not hesitate. We will be very, very happy and very willing to answer all your questions. So I hope you enjoy this workshop. Okay, thank you very much.
Great, thank you very much, Isidro, for these opening remarks. So now I'm very happy to introduce our first panelist, who's Rida Krisht, and she's the Impact and Evidence Advisor at World Vision, Middle East and Eastern Europe. And so Rida, over to you.
Thank you so much, Manal. And good morning to everyone, and good afternoon to everyone as well. And thank you for being here. I'm excited to actually share some highlights from our multi-country study exploring the transformative potential of cash and voucher assistance, or CVA, across 7 countries in the Middle East and Eastern Europe, in a region that's actually shaped by conflict, climate change, natural disasters, and demographic displacement. CVA interventions tend to focus on women and children, or the benefits of women and children. And while progress has been made, some challenges remain, like deepening community engagement and ensuring sustainable impact. Our research addresses critical evidence gaps by examining CVA's impact on mental health, livelihood resilience, GESI, community cohesion, and child well-being. To begin, next slide, please, we'll explore the global and regional contexts that shape the research, followed by the study's objectives, geographic scope, and its focus on 5 key outcome areas. Next slide, please. Our study was designed to meet urgent needs across vulnerable communities with 3 primary objectives. First, to assess the impact of CVA on these understudied areas of mental health, psychosocial well-being, livelihood resilience, community cohesion, gender equality and social inclusion, and child well-being. To identify best practices and strategies that optimize these programs, ensuring they're both effective and locally relevant. And third, to generate evidence-based recommendations that enhance the sustainability and long-term impact. But globally, to situate the research, it aligns with some key frameworks already mentioned by Isidro in terms of shaping the humanitarian responses. It comes against the backdrop of growing global relevance of CVA. It aligns the key global frameworks, including the Sendai Framework of 2015, the Grand Bargain of 2016, HDP Nexus, and has gained some lessons along the way and adaptations during COVID. Finally, this research represents World Vision's regional priorities for impactful research that drives sustainable change. Next, let's look how the objectives are actually addressed in the study design. The study is guided by one central question: how does CVA impact these key outcome areas, and what practices can maximize its effectiveness across these areas? The areas that are explored, beginning with mental health and psychosocial well-being, that focuses on emotional, social, and psychological resilience, community cohesion, which emphasizes trust, inclusivity, and mutual support within communities, livelihood resilience, or the ability of families to sustain economic shocks, and also adapt to challenges and thrive in the long term. Jesse, ensuring equitable opportunities and empowering vulnerable groups. And finally, child well-being, supporting children's holistic development, safety, and participation in society. To capture this breadth, we analyzed 22 CVA programs across 8 countries, spanning diverse approaches from cash for protection and food vouchers to cash for work and microcredit. And alongside this, we challenged some of the common misconceptions, such as the myth that cash assistance fosters dependency or reduces self-reliance in the long term. Instead, while we already research and track immediate outcomes, this study looks at revealing CVA's potential long-term transformative impacts. Next slide, please. Our study used a sequential exploratory mixed methods approach, which allowed us to gather both qual and quant data across multiple phases, ensuring a thorough exploration of the domain. Phase 1 in June and July of 2024 involved AIIs with regional and local CVA specialists, as well as virtual collaborative focus group discussions with our own World Vision CVA program implementers. In phase 2, from August to September of 2024, we engaged directly with CVA participants, conducting 21 focus group discussions with children aged 13 to 17, 23 with adults, 23 focus group discussions with adults, as well as 8 in-depth interviews with mothers to understand the personal and community level dynamics and impacts of CVA. Phase 3, also in August and September of 2024, we conducted quantitative surveys with 1,380 CVA participant households across 8 countries, including Iraq, Romania, Syria, Afghanistan, Georgia, and others. We analyzed the qualitative data using QDA and the quant data with SPSS and triangulated findings. Next slide, please. Now, let's dive into the highlighted findings, focusing on key evidence areas such as mental health and psychosocial well-being, livelihood resilience, and gender equality. And we'll also share some emerging insights on community cohesion as well as child well-being and discuss next steps. Next slide, please, so I can give you an overview of our demographic profiles. Our study engaged 1,380 participants, CVA participants, across displacement-affected communities, or what we refer to as displacement-affected communities, DAC, reflecting diverse profiles. Among the respondents, you'll see 43% are hosts, 38% refugees, 12% returnees, and 6% IDPs. The sample is predominantly female at 68%, and 21% of the sample represents a female-headed household. Participants range in age from 16 at a minimum to 93 at a maximum, with an average age of 38. Household sizes vary, averaging 6 members and including 3 children. 14% have experienced child marriage, and 41% report disabilities or chronic illnesses within their households. Financial struggles are prevalent, and that we have overall 58% of households are in debt. Employment remains a challenge. 27% are homemakers, 24% work informally or are daily wage laborers, and 14% are unemployed. Key income sources include informal employment at 50%, NGO support at 29%, and formal employment at just 16%. And working members typically are the adult members in the household or the respondent themselves. Next slide, please. Looking first at mental health and psychosocial well-being, an overwhelming 94% report improved mental health and 93% feel more secure. CVA also significantly strengthened social connections with examples from savings groups in Syria and the Happy Space Initiative, which is a child-friendly space in Georgia, fostering community bonds. And as one female participant in Syria shared, I met new friends who are united by love and cooperation, underscoring that positive impact of CVA on both well-being and social ties. Interestingly, refugees at 93% and IDPs at 91% report the highest access to MHPSS, while returnees face some barriers, with only 45% accessing these services. Female head of households feel more secure overall, but face greater barriers to MHPSS compared to non-female headed households, as shown by a statistically significant difference in access. Next slide, please. Looking at MHPSS access by country, we see significant variation. In Syria, for example, versus Jordan, there are over 50% of the participants that actually report access to mental health services as very accessible, while in Lebanon, the overwhelming proportion of CVA participants respond saying that it is somewhat accessible. In countries like OPT and Georgia, access is more limited, with more than 30% of participants saying services are not accessible as at all. And one striking finding comes from Ukrainian refugee women, particularly female heads of households in Georgia and Romania, who strongly emphasize the need for accessible MHPSS services. And they express the need to, they even express, the willingness to use the services if available. Next slide, please. Now, focusing on the impact of CVA in enhancing economic stability and resilience, 89% of households report significant improvements in economic stability. That's not surprising, but what's surprising is returnees experience the greatest gains at 59%, and refugees also report positive outcomes, with 49% seeing major improvements. When it comes to income diversification, 67% of the businesses that started or expanded as a result of CVA, they're much more sustainable now. And 52% of those CVA participants who chose the income diversification route of actually prioritizing education and vocational learning over meeting basic needs, 33% of those found employment. And 71% overall report increased resilience to economic shock. Now, when we look at female heads of households, 73% of them prioritized purchasing long-term assets. And that's in comparison to 29% of non-female headed households, which indicates a difference in economic strategy between household types. Now, let's highlight the critical role women play in household economic resilience. Our findings show that women's contributions to businesses or services significantly impact households' ability to cope with economic shock. For example, when asked how their mother or another woman in the family running a business affected the household's resilience before CVA, 44% of women reported it does significantly improve the household's ability to adapt, compared to 21% of men. So there's a gender difference there in terms of how we perceive women's contribution. So despite these contributions, societal norms still tend to undervalue women's roles. Our analysis shows significant gender differences in these perceptions, with a significant p-value, and the data also shows an increase in women's economic contributions by 6%. Before CVA, we had 14% of households that have a women contributing to the household income. And after CVA, we have 20%. Next slide, please. Let's focus on gender dynamics and household decision-making, highlighting some positive shifts, particularly in communication and conflict reduction. 66% of households report improved communication and fewer disagreements post-CVA, and returnees again experience the highest improvements, with 88% noting positive changes in household dynamics. Particularly some women in Syria, Iraq, and Afghanistan note the gain in confidence in terms of being able to manage or co-manage household finances and make those household decisions. And when we look at refugees, only 47% report positive changes, and another 47% report no change at all. In terms of Ukrainian refugees in both Romania and Georgia, they are overwhelmingly single female-headed households. So the pre-existing family structure meant there were limited benefits there. And as one female Syrian CVA participant put it, I have a more effective role in family expenses, and I go out of the house to attend meetings in the project and meet other women. There were also differences in communication shift by displacement status. For example, 84% of IDPs report improved communication and fewer disagreements, while refugees had the lowest rate at 47%. So it underscores that variation. Next slide, please. Let's focus on protection risks related to gender, specifically financial and psychological GBV within the context of CVA programs. It's important to remember that GBV, especially in such settings, tends to be underreported, as individuals would often conceal it to avoid losing access to CVA funds, introducing some bias into the data. But overall, 98% report no psychological pressure or violence to hand over CVA. 44% of the households that were actually under pressure, which are about 1%, report increased household tensions when they were asked about that. And 17% faced restrictions on how funds were allocated. Refugees experienced the highest rate of non-occurrence of these pressures, with 99% reporting no incidents, while IDPs had the highest rate of occasional GBV at 5%. The country-level insights revealed that Lebanon had the highest reported rates of GBV, with women, particularly married women from the host community, being the most affected. Next slide, please. And finally, allow me to share some key emerging insights related to child well-being, community cohesion, and some of the next steps for the study. Starting with child well-being, 76% of the respondents report that CVA significantly improved child well-being, particularly as it relates to access to education at 47%. And this is not surprising, as most of our cash for protection programs are in fact designed to meet some educational needs. Physical health and nutrition at 43%, and then less so emotional stability, as well as self-confidence and greater hope for the future. When we look at community cohesion, 68% overall report improved community relations, and this had the strongest impact on returnees and IDPs, while refugees saw fewer benefits in that area. And that might not be so surprising given the structural barriers and systemic barriers that they may face, given language integration and other issues. We also observed significant differences in CVA's impact on community cohesion by displacement status overall and by gender. So looking ahead, the final report with its detailed findings will be ready soon, hopefully by the end of the year or at max the beginning of the new year, and will be shared widely. While we intentionally avoided listing any preliminary recommendations today, I really look forward to leveraging our discussion to delve deeper into some of the emerging recommendations. Thank you.
Thank you very much, Rida. And just to say, I mean, to comment on what you were saying in the beginning of the growing global relevance of CVA, and just thinking about the State of the World's Cash report, which CALP launched last year or published last year, looking at the potential for CVA to become or have a higher percentage, let's say, of overall humanitarian financing. So from 21% as it was last year to between 30 and 50%. So it's really, reports and findings like this that shows the potential that CVA can have on multiple areas that affect people's lives. So it's great to see such a comprehensive study and comparative data from across different countries. And it's particularly interesting to see some of the quotes and quantitative findings alongside the qualitative findings, of course. Really great to see the focus on people-centered aid, which is something, as many of you know, that we at CALP are really trying to push for. Really, I think important findings, particularly on gender and inclusion, as we also kind of explore these relationships in MENA, but also globally. So thank you very much, Rida. Again, just a reminder, if anyone has any questions, please do put them in the Q&A box, and we will come to them at the end of the webinar. So thank you again to Rida, and now it's my pleasure to introduce Shafak, who's the project manager for World Vision Syria Response's cash program in Turkey. So Shafak, over to you.
Thank you, Anna. Today, I almost talk about our CVA program in Turkey that especially enhanced after the earthquake. If we can go to next slide. Yes, next one, please. Our earthquake response started between March 2023 to May 2024. If you just remember that the earthquake happened in February 2023, we immediately start our implementation, and we just start our operations in the mostly heated cities, which is Adıyaman, Gaziantep, Hatay, Kilis, and Şanlıurfa. We distributed around 4.7 million USD under CVA support and reached more than 15,000 households. As you can see, the breakdown for refugees and host community across 4 cities and 5 districts. I will give some details about the breakdown that we have. As you can see, like a 50% ratio for refugees and host community. I will give details in the next slides. Next one, please. As you can see from the map, it was a huge earthquake. Actually, it was 2 major earthquakes. The fault zone just lay down from Hatay to Adıyaman as a straight line, which passed inside of the Gaziantep, which caused like horrendous damage in all cities, including Kilis and Şanlıurfa, which as a precondition of the earthquake, it was like vulnerability was quite high, and earthquake make it really tougher for these cities as well. So the Hatay, Gaziantep, and Adıyaman we can call the most affected cities. And as you can see from the breakdown, each color represent different projects. We focus on Gaziantep and as much as Hatay and Adıyaman at the same time. Next slide, please. The main 3 projects that we implemented for the earthquake response was 0555, Special Fund Project, and CCK project. Under the Giro, we implemented in 2 cities, Kilis and Şanlıurfa, distributed around 1.4 million USD, and we reached 4,000 households with the breakdown I have mentioned. For the Special Fund Project, we implemented in Adıyaman and Hatay. It was wash-related voucher, wash-limited voucher, and we distributed around 300,000 USD, and we reached 1,700 households in both Adıyaman and Hatay. For CCK, it was market voucher that we distributed in Gaziantep in 5 districts, and we distributed more than 3 million USD, and we reached more than 10,000 households in the city in 5 districts. Next slide, please. So what was our success and key achievement in this post-earthquake response was the first thing is early engagement with local authorities. The advantages of having direct contact with the local authorities will give us critical insights on needs and enabled effective reach to the most vulnerable, because as you can imagine, the post-disaster times, a little bit chaotic times, and you need to know where to go, where to start, and where to operate. So our meetings with our local authorities will enlighten us about whom to reach, where to reach, and how to reach. And also, in addition to this, the validation process of the participants is quite a bit hectic during the disaster times. So we also validate our participant list in collaboration with the local authorities to ensure equitable access to aid to anyone who affected from the disaster. The second success or key achievement that I can mention for the post-earthquake response is we processed the CVA support like in first 6 in first 6 months after the disaster. Actually, the first project started right after, like 1 month after the disaster, and the other two follow it with 2 months later. And we provided this support to address the urgent needs of our participants, to just give them a little bit stability in that hectic times. And also, thanks to this timing and thanks to this access that we gained through engagement with local authorities, we reached the hardest hit communities during the emergency. As you can imagine, the earthquake hit everyone with same damage, without the nationality, without the previous financial conditions and anything. So we reached the hardest hit communities immediately right after the earthquake. Next slide, please. Of course, we had some challenges, and also we have some actions taken to overcome these challenges. We can divide the challenges, like the pre-earthquake context and post-earthquake context, into two, and our response to these challenges in two ways as well. The first situation is pre-earthquake context, which is, as you know, Turkey was hosting majority of the refugees from the Syrian conflict, and the aids naturally previous to focus on refugees in the country. So it created a little bit tension at the host community. And due to the economical decline in like recent years, the tension just grew day by day. So it was the condition that we had just pre-earthquake support that we implemented. The second part, the second challenge is post-earthquake challenge, of course. As I mentioned, the earthquake hit everyone, regardless their nationality, their financial situation, their background, and anything. So it required a new approach. It required a balancing aid system to overcome any potential backlash from society or hinder any social cohesion situation in the country. So how we overcome this issue? The first thing is we implemented 50% ratio for host community and refugees. At the end of the day, thankfully, I can say that we distributed our support like 52% to refugees and 48% to host community, which closely just engage with our target at the beginning. And to make it possible, we also make some awareness raising, especially among the host community members, because host community members do not familiar with the international organizations, do not familiar with the receiving aid from any non-governmental or international non-governmental organizations. So first we raise awareness amongst them, and also give clarity about the aid distribution process, that they will be included as well to avoid any potential backlash from them. Even we do these precautions, we face some backlash because of the tendencies that host community members think that the support only goes to refugees, but with the clear communication line, we just overcome this issue, thankfully. Next slide, please. One of our major success that I just want to specify it beside key achievements is women's decision-making and protection through CVA support. And also we combine the voucher support and case support, especially from the women perspective. Our post-distribution monitoring results show that women participation in Turkey, especially after virtual program, is quite empowered, and they just more involved in the household's decision, especially about the family spending and children's well-being. As you can see in the chart next to text is of our participants says that they decide together, husband and wife decide together about how to spend the voucher. 16% says that their wife just decide how to spend, and 4 and 6% is just like limited numbers saying that the men or other members of the families just decide how to spend. So it shows that, it proves that the women's involvement in the decision making just increased thanks to the CVA support that we provided. And also, as we have a testimony from a voucher support participant, she mentioned that she able to buy a birthday cake for her daughter and make her happy, and she wish just goodwill for anyone who make it possible. Next slide, please. How we ensure this women participation and just strengthen their position is just make them involved in this process. And while doing so, we try to minimize GBV protection risk as much as possible with respecting cultural norms, and also ensure a safe environment for women to involve in the system. Not only about redemption, it's also about from selection to distribution and for whole process. As you can see from the data that I'm sharing below, is like it was accessible for both males and females, 99%. And also we provided separate queues for female and male to just, as I said, minimize the risk for GBA perspective. And also we try to engage at least one female staff all the time, stable in the distribution points as well. So we try to get women involved as much as possible without bringing any risks to them, and empower them to who feel like more safe, and they will just involve in the decision making and also in the redemption and any part of this process. Women get involved more, and we are really thankful about to just receive this scores, or let me say the reply from our participants. Next slide, please. What are our key lessons and best practices that we can transfer to our future CVA program design? The first thing, as I mentioned at the beginning, the local authority coordination is crucial. Local authorities just ensure accessibility and reach the most vulnerable participants, because during the disaster times, it's also same with the conflicts as well. As we can see that there are some living areas. It will be container, it can be tent, etc. These areas are controlled by the, of course, local authorities. So in terms of the access these areas, it's a must to engage with the local authorities, and also to just to be able to spend resources efficiently. It's always better to validate the list, to just not overlapping support, duplicated supports, to validate it from the local authorities to avoid this inefficient resource using. The second thing is time start of the support and also duration of the CVA. The CVA support is really vital within 6 months after the disaster or conflict ending, and it should be, just as a suggestion, it should be completed 12 or 18 months later that start of the implementation, to avoid any prolonged dependency among participants to the financial support, especially the CVA support. The first 6 months is vital for them, because the stability of their life, to their incomes, their family life is really problematic. But with this CVA support, we just give, of course, not the full stability, but we just initiate at least the beginning of the stable life for them and for their families. The second thing, to avoid any prolonged dependency, we just suggest to transfer CVA support to the livelihood activities, to make them generate their own income, and just take their own income opportunities, to not dependent on the support that provided under the CVA programs in an organization. And the suggestion is for not only us or any organization, which includes the local authorities as well, is establishing a data sharing platform to ensure effective targeting among vulnerable people. This data sharing system between NGOs and INGOs will be quite helpful to prevent duplication of support, because most of the time, in the sake of the implementation, we are just trying to go, all organizations trying to go most affected areas. But if we all focus in the same areas with the same participants, of course, we will missing some people who also in need of this support. So if we could have any kind of system that we share amongst organization, it will help us to avoid the duplicated support. But of course, we need to mention data protection law that limits this sharing. But as a suggestion to maybe discuss further with the questions and answers, is what we can do to just establish a system without, avoiding to data protection laws regulations. Next slide, please. Lastly, I would like to mention participant satisfaction with the CVA program in Turkey. 74% of our participants says that their satisfaction with the redemption process is strongly satisfied. And also, if we include the somehow satisfied participants, it reached 98% of our beneficiaries. Satisfaction with the distribution process is also, if we combine these two satisfied participants, it's reached to 98%, which is great values for us. And finally, satisfaction with the e-voucher system the modality that we use, especially for special fund project and CALP project, is like limited voucher, not distribution cash, but limited voucher to certain markets or for certain products, as I mentioned, for the watch products, etc., is 94%. So cash support, of course, preferable for our participants. But when we implemented voucher system with some limitation, but for the sake of their needs, we receive positive feedbacks from our participants as well. So that's all from my side. Thank you.
Great, thank you very much, Shafak. And it's really great to see you highlighting the work that you did and the very valuable lessons from your response. I mean, it's really good to highlight some of the things regarding the timeliness of the response and how that enabled people to really address their needs. And it was really great to see that this didn't only help people kind of satisfy their basic needs, but it also greatly contributed to their well-being as well. So thank you very much for that presentation. And yeah, again, if anyone has any questions for Shafak, please do put them in the chat. And yes, if there's time in the end, definitely be interesting to come back to the question of data sharing and interoperability of systems and deduplication, as that is an issue that has always been there, but has been coming up, I think, more and more now that we've been seeing in the region. Great, thank you very much again. And next, I would like to introduce Kuzmina, who's our next panelist, and she's the General Director at DGA SMB, which is an organization, a CVA implementing partner with World Vision Romania. So Kuzmina, over to you.
Hello, everybody. Thanks for having me in this very interesting workshop. I represent the local authority that Shafak spoke earlier, and we are also a partner with World Vision during the refugee crisis, Ukrainian refugee crisis here in Romania. I'm mindful of the time, so I will just give you a little insight of our work together, and the results of our work together you can find in the report that Rana will distribute to everybody. So Romania, as you might know, is one of the poorest countries in the European Union. So when the war started, and with little or no experience at the level of local authorities on how to deal with refugees or with big waves of migrants. So imagine when the first day of the war were in Ukraine and thousands of women and their children came to Bucharest either to stay here or in transit for other Western European countries. We were a little off guard with everything. We knew little about humanitarian help, of what to do with those peoples, how to better address, about safeguarding procedures. So who came in our rescue, let's say, it was World Vision International that very quickly sent a team here, and we start working together. We had no previous collaboration with World Vision at the level of municipality of Bucharest, which is the capital of Romania. And we were forced in only 12 days to find solution for those thousands of women and children. And what happened is that in 12 days since the war broke until today, we are still working together on several projects, and we established the biggest humanitarian center where all the CVA programs were carried on Bucharest for a big part of the country. Of course, until now, until yesterday, almost 400,000 people were served during various programs. And it wasn't easy. It wasn't easy from any point of view because we needed to make working together two separate teams. It was an NGO, an international organization with a local authority. We all have different way of approaching things, but there was one thing in common that unites us and help us work better together. The amount of reporting and bureaucracy that was required from also your programs, but also from our accountability system, made us work very well together. And the main focus in Romania when dealing with Ukrainian refugees, we followed 2 points. One of them was the host community, that the people that spoke before me touched the subject because it's very sensitive. How do you help the host community so that it won't create frustration within the host community? And the second one is to always tailor our programs in order to better respond to the need of the people we are helping. And we did several focus groups. We did a lot of inquiries with the Ukrainian refugees in order to make the CVA programs as much as approachable as they can be. And for us, it was important to do so because when you saw in Gida's presentation that Romania has reported the lowest values of MHPSS support, because also for Romanian, for host community, and also for Ukrainian refugees, because we don't have that many support services. So for us, it was important when working with World Vision team to design our programs in order to respond to the basic needs of the people. Either it's food, it's cash assistance, it's vouchers or non-food items. And on the other hand, to offer some MHPSS services because they were not available elsewhere outside the distribution point. After 3 years of working together, we are considering that the system we implemented here in Romania is something that we need to keep. We have our lesson learned, and if by any chance it will be another crisis anytime soon, we will be able to replicate the good examples and the successes that we had working together, but also to avoid some of the obvious mistakes that we did, and to make our programs better. So because we are external partner of World Vision, I would like to thank all of you who work together with us, because I know many of you were involved in the refugee crisis here in Romania. And I would also like to have a big thanks for the Romanian team here of World Vision, who has been extraordinary, and we are keep working together for the vulnerable groups, either from the host community or the refugees. Thank you very much for having me today.
Thank you very much, Kuzmina. I believe there's a short video that will be shown. Kate, will you be playing that now? Yes.
Узнали от волонтерского центра Кати. Там как бы все друг друга рассказывают о поездках в других городах, допустим, и что можно взять для детей, какие есть варианты помощи.
World Vision Ukraine Crisis Response, together with World Vision Romania and other NGO partners, have set up here in Romexpo Hub Center a social store, just one of the services that we provide, where families can access food and non-food items. Inside the store, they can get clothing, hygiene kits, baby food, diapers, and other food items. Also, you can find here a child-friendly space where parents can leave their children with our staff while they are accessing our store. Ukraine refugees visit the social store every 10 days, and every day we receive more than 1,000 people, and they continue to grow as the Ukraine crisis continues.
Организация World Vision, конечно же, большая благодарность за помощь, за содействие в организациях помощи для детей, не только для детей, как говорится, и поддержки для родителей. Большая благодарность, конечно.
We are happy to say that we are able to provide them their needs with dignity and freedom to choose. But more needs to be done. We are grateful for our donors and partners that together we continue to make an impact on the lives of the Ukrainian refugees.
Thank you. Thank you very much, Kuzmina, and really great to see kind of refreshing self-reflection, I think, and really highlighting the importance for working with local partners for sustainable outcomes for both refugees and the local communities as well. So next, I would like to introduce Mette Carlson, who's the head of the Cash Assistance Unit at UNHCR Jordan, for her presentation. So Mette, over to you.
Thank you. And thank you to everybody for joining today. You can start the presentation. Thank you. So I've been asked to talk about UNHCR and MENA in terms of the cash approaches and trends and innovations and such. So I will talk about MENA, UNHCR, and MENA as a region, but then also focus on the programming that I know much better, which is in Jordan. Next slide, please. Okay, so in UNHCR across the region, or UNHCR Global, we have taken a why not cash approach. And for most operations, it should be the default response mechanism to the displacement crises that we see. So we use multi-purpose cash, unconditional cash across the region. And we have Lebanon, Jordan, Yemen, Iraq, and Egypt that are among UNHCR's top 10 cash programs globally, with Lebanon and Jordan significantly higher than the other countries there. We use cash across 16 operations, and last year we programmed $243 million, reaching 2.8 million people. So as I said, most is unrestricted because as aligned with the why not cash approach, we feel that there is a lot of dignity in choice. We very much see cash as a protection tool. We have been able to leverage this cash for protection, or this social protection cash assistance, to integrate with national social protection systems in Iraq and Mauritania. And in Jordan, we've been focusing a lot on using the delivery modalities to enhance refugee financial inclusion. And I'll talk more about that later. Across the region, a lot of the cash is actually still cash in hand or over the counter, but 81% of it is through digital means. In other words, it's not, cold hard cash coming from the bank being transported in suitcases like it was when I was in Liberia during the Ebola crisis, but rather through bank transfers. And across the region, there's about 18% that go through bank or mobile wallet accounts to refugees. In Jordan, about 70% of refugees that receive cash assistance from UNHCR receive it through mobile wallets. And in host community, in refugee camps, it's higher. It's at 98%. Now, for UNHCR, we have a lot of well-established operations, particularly related to the Syria crisis. So we have established platforms for biometric registration and identification, and we do use digital and other blockchain technologies. Next slide, please. So again, looking at MENA, the findings here very much align with WFP, my apologies, World Vision's findings. 95% of the surveys that were carried out across the region, the refugees responded that the cash assistance did in fact improve their well-being as they define it. And 95% of those participating in our post-distribution monitoring do prefer cash over any other modality. Unfortunately, only 52% report that the cash assistance that we provide meets at least half of their basic needs. I think UNHCR, along with most actors in the humanitarian space, are always going back and forth between the scale versus scope approach to cash assistance. Do we reach more people with less money or less people with more money? And that's reflected in the 52%. 86% say that they can buy what they want, where they want it, at the quality that they want, which is great, which speaks a lot to the market integration and healthy market systems. And in general, we have a 50-50 split of men household cash collectors and female household cash collectors. Next slide, please. Now, we've been using, as I had mentioned before, we're increasingly using mobile wallets as stepping stones for refugee financial inclusion. They're just a tool towards promoting greater access to financial services and products, not just for refugees, but also for lower income populations. Some of the enablers for this are the biometrics infrastructure that I mentioned before. We have an API direct with one of the parastatal, like the government clearinghouse companies, payments clearinghouse companies, that verifies the ownership of a specific mobile wallet, so it mitigates fraud. In Jordan, being a middle-income country, there's very high smartphone ownership, internet, cell phone penetration. It's over 90%. So the infrastructure, the technological infrastructure is there. Also in Jordan, we're very fortunate to have a strong ally and collaborator in the Central Bank of Jordan, which has included refugees as one of its 6 priority groups in its new national financial inclusion strategy. We're working very closely with the private sector, super agents, etc., at increasing the digital payment options. So what we mean by this are the point of sale terminals with bill pay services and things like that. Now, the challenges for us related to the mobile wallets are that currently, at least in Jordan, only Syrians can open up mobile wallet accounts. Non-Syrians cannot. So this obviously limits the impact of the financial inclusion efforts, both by us and the national government. Also, Jordan, like many countries, there's a very high percentage of the economy that's informal. And so that means that you have a lot of refugees that are working under the table and not getting paid through formal means. So this is a challenge for people getting their wages paid through formal accounts, etc. And then one of the biggest challenges is, of course, the poverty among the refugees. Over 80% of the refugees in Jordan are poor. And when you are poor and really don't have enough money to even meet your basic needs, it's very hard to save money or to make informed financial decisions, because you're basically just trying to keep yourself and your family alive, meet their basic needs. Next slide, please. Now, UNHCR definitely sees cash as a protection tool. As you likely are aware, UNHCR in refugee settings leads the interagency coordination. And also those cash people like yourselves are also aware of the cash leadership group, the CAG, Cash Caucus, that designated UNHCR as a lead for cash working groups globally. In Jordan, we do not have a specific cash working group per se. We actually have 2 existing working groups. We have the Common Cash Facility in Jordan, which is a sort of membership-based entity that allows all members to benefit from economies of scale, framework agreements with financial service providers and the biometric service providers. So they sort of focus on the delivery side of cash. And then the Food Security Basic Needs Working Group, which looks at the programmatic side. UNHCR also undertakes a variety of activities that also benefit the broader cash community. We do periodic refugee socioeconomic assessments. We're doing skills mapping, where we're mapping the skills, training, education, aspirations of refugees in terms of what they want to do from livelihoods, what their capacities are for livelihoods, and joint targeting with WFP. We also have joint platforms, such as the Refugee Assistance Information System, which helps with deconflicting and deduplication of assistance. And next slide. I think that was it. Thank you.
Great. Thank you very much, Mette, and thank you for outlining UNHCR's cash response in MENA, but also the importance of the UN's role in cash coordination globally, but also obviously in many of the countries that we're working in. Thank you. Last but not least, it's my pleasure to introduce my colleague, Manal Shhade, who's the Deputy Regional Representative for CALP Network in MENA. So Manal, over to you.
Thank you, Rana. So I'm gonna kind of start, just kind of see if the slides are on. Can move it to the next slide. So kind of everybody quite online probably knows the work of CALP globally. So I'm just gonna start by focusing on what we do and what we prioritize in MENA. So we work with focus countries, and that's very much depending on the context. So at the moment it is like Lebanon, Syria, Palestine, and Yemen. We respond to crises within the cash and voucher assistance and kind of provide support to cash working groups and basic needs working groups across the MENA region. We also have our own community of practice, which is kind of a sharing and learning space for CVA practitioners that they come discuss. We have at the moment the social protection in CVA, MPCA, and locally led in response. And we also host our regional technical forum, which brings in CVA actors and donors and practitioners across MENA to kind of a shared learning space and expertise. And we work kind of on building the network that has CVA programming across MENA, as well as policy and research, and what we most known kind of for the capacity building within the CVA sector. Next slide. I wanted to kind of focus more on the importance of coordination and local partnership. As CALP, kind of we see that collaboration and partnership are essential to delivering impactful and efficient cash and assistance program. I mean, if we're looking at coordination, kind of we see it as kind of key and important to have effective coordination to prevent fragmentation and efficiency. I mean, it allows the humanitarian actors to align their effort, ensuring cash assistance reaches those that are in need, and to avoid duplication, which is quite important, and that the resources are used strategically, and because uncoordinated effort can lead to kind of overlaps and gaps within our response. And kind of looking at that as well in terms of coordination and local partnership is kind of leveraging the expertise of local partnership and local organizations on the ground. We're very much in terms of the new coordination, the cash coordination models, which kind of has not only local actors attending cash working group, but also coordinating it and coordinating the cash responses. So we've seen it across kind of Turkey, Iraq with the durable solution, Northwest Syria, and as well as Egypt, and the importance of having local voices in the coordination, as it's also kind of looking at sustainability and recognizing, and I think we all know, usually in any crises that are seen, local organizations are the first responders. They have expertise and wealth of knowledge as they are a part of the community. They know the context, they know the nuances. So we're always kind of leveraging those local voices and seeing them and recognizing them as not just implementers on the ground, but actually are in partnership and are the first responders in any crises that are happening. And when we have them as in terms of full partnership with us, we're actually also looking at sustainability across the different regions and especially in MENA. Next slide. I just kind of wanted to leveraging on the kind of the findings of the research that the reports that have been shared and kind of looking at enhancing effectiveness and sustainability of cash assistance, kind of looking at the great results of these and the findings of this and looking that, you know, the cash response in either way, it needs to be tailored to the context. And looking at it not sometimes as just a standalone and seeing the impact of it as not just kind of the basic need, the leveraging of the mental health, the strengthening of the livelihood resilience, promoting gender equity and inclusion, and building community cohesions. We've seen great findings of when it's seen and leveraging, and also seeing not just as a standalone CVA, but also seen as a cash plus and seeing it, how it's leveraged and the impact of it and the sustainability of it. And actually also kind of always looking, and this is something that we call for CALP, of having more people-centered aid. You know, CVA programs does not necessarily mean that they're people-centered aid, and always taking the community's needs to the center of any CVA design, leveraging the needs of the community and tailoring it and also taking the locals, the organizations, kind of what they see and having them design jointly any CVA programming, that has quite an impact on the sustainability and effectiveness of any cash response. So that's it from my side. I know that we're very tight with time, so I just wanted to kind of finish and wrapping it very soon. Thank you, Ran.
Great, thank you very much, Manal, and all really important points, and to link in with the report's findings and what we're doing at CALP. So thank you for that. Great, so thank you very much to all our panelists. Please, if anyone has any questions, do put them in the chat or in the Q&A box. I saw there were a couple of questions to Rida in the chat, which she has already answered. But while people are thinking, maybe Isidro, if I can come to you, I know you talked a little bit about leveraging CVA and really the importance of it being a modality that is really people-centered. So I wonder if you can say a little bit more of how can we ensure that the CVA strategies, maybe at organization level, donor level, etc., are really people-centered. And thinking particularly on conflict or crisis-affected context, like those that unfortunately we are experiencing in the MENA region.
Thank you, Narana. Well, I think this is an idea that we are still learning and improving, or trying to improve at least. And I think basically it all starts with the assessment, no? So that we actually have a comprehensive understanding of what people priorities are and needs, and also how people can access safely these financial services we offer. No? So we are also trying to pilot cash transfer that do not look only to the place where the people are staying at that moment, but what are the plans in terms of their mobility? No? Because we know that in areas where there is a lot of conflict, people are very mobile. They get displaced, and the access to the financial service that they have in the community where they are living now, maybe that changes dramatically, no? Next week, or the moment that they cross a border, or the moment that they are in a different place, no? The conditions are totally different. No? And so we need to have this in mind, no? And not only look to the analysis of the community where people are living now, but also where they can be moving, how this changes their access to the financial service, how this changes the transfer value we provide, no? And also in terms of security protection aspects, no? As the colleague from UNHCR mentioned, cash is an essential tool for protection, and so to ensure that we provide, comprehensive support and protection services to the people on the move. We really need to be flexible and design projects that are not looking only to a certain geographical location, but they look to the whole route, no? That the people will be moving, no? From beginning to end. And I think it's quite challenging, to be honest. No? I think thank you to the availability of technology, and also building on people's capacity, no? And building on local resources, no? What we said about the localization strategy. So we are starting to pilot and to see different ways of designing our CVA schemes to overcome these challenges that the people face, no? When they are especially on the move. No? So yeah, I see, and also thank you to this, to this webinar and these forums. We can actually exchange our learnings, our experiences, and as a sector, no? As a humanitarian sector, we can actually improve faster than if we work in isolation, no? and working in silos. No?
Yes, absolutely. Definitely important to share these types of knowledge and experiences across different actors who are working in multiple countries. And yeah, thank you for highlighting the issue of human mobility and roots-based approaches, which is again something that CALP is looking at, but I know it is more let's say, more of a thematic focus for us in the Americas. But thinking or looking now at the MENA region, all the movements that we are seeing, with the recent events happening in Syria and in Lebanon, and really important for us to look ahead and see, as people move, exactly as you said, kind of how do we design these cash programs to enable people to access CVA assistance, but ultimately for them to be designed to respond to their needs as they make their movements. Great, thank you very much, Isidro. So I see a question in the chat by Judith. Judith, I'm not sure who this is directed to, so if any of the panelists would like to answer, please unmute, but I will ask the question out loud. So Judith is asking, are there some special strategies put in place to ensure inclusion for persons living with disability to ensure that no one is left behind? So I don't know if any of our panelists would like to comment on that. Related to the report or any of your work related to CVA. Mette, go ahead.
Thank you. At least with UNHCR, so we do here in Jordan, at least, we conduct home visits to families as part of our eligibility determination. And we place priority on households with members that do have disabilities or chronic medical conditions, prioritize them for our regular cash assistance, and also for our delivery mechanisms. We have 3 types of delivery mechanisms. We have mobile wallets. Then we have iris-enabled ATM machines where you can just use your iris, and then that opens up a virtual account where you can withdraw your money. But then we also have ATM cards. And very often we find that it is the people with the disabilities, either mobility or other disabilities, that prefer the ATM cards, because then they can, it's easier for them to just use that to withdraw the money or give it to a family member to withdraw. So those are just a few tactics that we use here in Jordan to ensure that we are being responsive to persons with special needs. Over.
Great, thank you very much, Mette. And yeah, I mean, the whole, or let's say one of the main reasons behind using cash and voucher assistance is that it provides, obviously, greater dignity and choice for people, and thinking particularly about people with disabilities and how this can be adapted to provide them with these options. So great to hear about what UNHCR is doing related to this in Jordan. I don't know if there are other questions to our panelists, but again, while people think, Shafaq, I don't know if you'd like to come back to the issue of data sharing and interoperability. I know, this is definitely an issue that has been coming up more and more. I think a question would be, or maybe if you can provide some reflections on cash coordination and the role that has, and the involvement of authorities that you mentioned, and particularly on deduplication related to the timeliness of the response, and what maybe needs to be in place as sort of preparedness for a crisis.
Actually, it just comes from some reflection of our participants. Because you keep hearing so much things during distribution times, like at the distribution point, some of people who's not selected, they say that they didn't select it, but some people keep receiving same support from different organization, or they're saying that you are just supporting host community, you are not supporting refugees, etc., opposite way. So these all come from the participant section, participant's perspective. To overcome this issue, because when someone comes to you and saying that same people keep receiving the support, but we are not receiving, you don't have any tool to say that, no, it's not like that. If we can enhance any kind of data, like sharing system amongst the organizations, we will be able to just validate this. I mean, the idea that our participants or potential participants has. The thing is, we discuss it through our local authorities in Turkey after the earthquake, especially, because it was like a major one, and thanks to the all international communities, people just come here to help. The national organizations also try to provide help, etc. So At some point, there was a group of vulnerable people, group of organizations, and we all tried to go the same places and try to do somehow same thing, especially in the first 6 months of the projects. We discussed with the local authorities how to overcome this issue, because there is some central institution, Turkish Red Crescent, also organizing all kind of supports, even before the earthquake for the refugees, and after the earthquake also they were operational. The thing is, we always come to point of the data protection law to stop us, especially in Turkey. And for protection projects and other projects, UN also established a system about just referral system to, like, if there's some beneficiaries that we cannot help, we can refer to the other organizations who can help in some other sectors. We try to establish that kind of thing. Maybe if we can do it, for example, sharing at least the participant list that we have, maybe all organizations can share their participant list somehow in an online system that we can see, and maybe some elimination. But based on our discussions with our lawyers, also this one, without sharing it like through email or as a document, but view it online, is against the data protection law. I don't know how we can overcome this issue, but at the end of the day, hopefully we will not have that much crisis in the upcoming future. But unfortunately, for sure, that we will have some crises and disasters. But we just suggest to establish a system, especially together with the local authorities, the local governments, if it's possible. Maybe they will be the one who control the data, which help us to just get rid of this data protection of somehow, to ensure that we are reaching people in need that didn't reach before by another organizations.
Great, thank you very much, Shafa, for those reflections. And yes, I think we all, throughout our work, have come across a lot of technical solutions to the issue. So it's really, yes, about kind of the data sharing agreements and let's say the kind of policies that can prevent the data being shared, and issues of who controls the data, how that's transferred, etc. So I think it's important to differentiate between the technical challenges as you were saying, but then also the reasons behind the delays, or sometimes the challenges in that happening. Mette, I saw you raise your hand. Did you want to come in on this issue?
Yeah, I just wanted to say, I mean, in Jordan, we have the Refugee Assistance Information System, where an implementing partner can look up in the system to see who has received what from whom and for what purpose. I'm not an expert on how the RICE system works, but essentially actors that provide assistance in Jordan, again, this is a very well-established operation, as it likely is in Turkey, but partners set up DSAs with UNHCR, and then they gain access to the RICE system. So when they go in there, they can see, WFP gave to these people for food, and then World Vision gave to these people for child protection, NFIs or something like that. So it's not a system without its challenges, but it does go a long way to deduplicate and maximize the reach of the assistance here in Jordan.
Great, thank you very much, Mette, for sharing that. I see a hand raised in the audience. Shamisa, would you like to come in? Shamisa, I don't know if you're able to unmute yourself, or maybe the hosts can help us if you can hear me. Okay, I see you've removed the hand, so maybe it was by mistake, but if you do have a question, please do feel free to type it in the Q&A chat. Great, so again, maybe while people think through any questions, because Mina, I wanted to come back to a point that you raised, on kind of the bureaucracy and reporting. maybe that local partners and international partners face the same. And you were saying, that's something that united you to work together. And obviously, while that's great and important, we obviously do hope that changes and reduces the multiple layers requested by donors. But I don't know if you wanted to say more on that, from your perspective as a local organization, and particularly related to CVA programming. Maybe what do you think needs to be in place to maybe reduce this bureaucracy and this kind of multiple demands on reporting? If you'd like to say a bit more on that.
Thank you, Rana, for this question. As I mentioned, we are a public institution here in Romania, in Eastern Europe. So for us, bureaucracy is our middle name. We wouldn't think until this crisis, until working with World Vision, that is possible for another organization to be more bureaucratic than us. And here you are. And we talked about it, and the first issue that we are having is something that Safak also mentioned, that data protection law that exists in Europe, and kind of forbids us to exchange data between us without very much papers and agreements and a sign from everybody who is database, and that put a lot of pressure on us. And what we are trying to propose, and we are trying to do here in Romania, is effectively replacing the names of people with codes, that we make each people a code based on a common understanding of what a code should be comprised on. The first two letters of the middle name followed by the last 4 digits of their personal identification number, or different various aspects that will allow us to exchange more easily databases in order to avoid double financing. For example, we managed to do that with Red Cross. Red Cross is also an international organization, and it was very difficult for us, but we managed to find a system where we cross-check everything we are giving on CVA programs with the Red Cross. So it's not impossible, but it requires a lot of work from our teams based on the specific of each organization, each country, and so on and so forth. We had extensive meetings with your colleagues from the MEER team that acts here in Romania, and they were very, very helpful, and they have very nice insights on how this could be done.
Great, thank you very much, Kazmina, for sharing your experiences on that. Great, so I think we'll be closing the session here. Just to note that the final report is not ready yet, but it will be hopefully ready by the beginning of January, and will be shared with all of you, and will be available for anyone who would like to delve deeper into the findings. So thanks again for joining. A big thank you to all our panelists and for all your valuable input into this webinar. And we hope everyone has a great rest of the afternoon.